Nice. So, okay, I will switch to preview mode. So first of all, I would like to thank Ramon for giving me this opportunity to present today. So I'm Anastasia, I'm a pharmacist, and I'm from Greece, but now I'm in Netherlands, and I'm doing my master's. So, as Ramon said, we were looking at the changes and the impact of the pregnancy prevention program in two products, valproat and the retinoids. And so our aims were first of all to evaluate this awareness of the pregnancy prevention program and the risk of the teratogenic effects in women of childbearing potential age and in pregnant women when exposed to these products. And we wanted to ascertain this awareness among patients and healthcare providers, including pharmacists and general practitioners and specialists. Also, we wanted to ascertain the adherence to these measures with a special focus on the use of the educational materials, the use of effective contraception for women, the performance of medically supervised pregnancy testing, and of course, the signature of the patient to the prescriber's checklist, the risk acknowledgement form that Ramon has mentioned. So, in order to do so, we included 8 European countries: Belgium, Denmark, Greece, Latvia, Netherlands, Portugal, Slovenia, and Spain. You can see that there are, there are countries with a wide geographic spread and variation in healthcare systems and cultures, of course. So we included prescribers, pharmacists, and women in childbearing age, meaning from 15 to 50 years old. And we collect data using electronic surveys that included closed and open-ended questions. And the analysis of the survey generate descriptive statistics. To do so, the recruitment strategies vary per country. We recruit healthcare professionals through professional organization and networks, also through professional app alerts, and the patients were recruited through social media, patient organizations, and from their own healthcare providers, meaning the pharmacists and the doctors. For the scope of this presentation, I'm gonna present the results that derived for the pharmacists and the women. And also, I was responsible only for the quantitative analysis of the closed-ended questions, so I will present these results. In order to start the analysis, we had set some criteria, of course. So for valproate, we started with 428 patients that gave informed consent and responded to at least the first question, but we excluded the patients that weren't women, that were pregnant at the moment of the survey, or that they have never used valproate, of course. So we end up with 323 patients that were eligible for the analysis. And the baseline characteristics of these patients were mean age 37 years old, ranging from 16 to 51 years old. In our sample, we had all the levels of educations, but the most prevalent were the undergraduate education and the vocational education. And for pharmacists, again, we started with 720 pharmacists that gave informed consent and replied to at least the first question. We, of course, exclude the ones that have never dispensed valproate, and we end up to 563 pharmacists eligible for the analysis, with baseline characteristics 39 years old, mean age, ranging from 21 to 69 years old. Of course, we can see that pharmacist is a female professional. 74% of the responders were pharmacists, and almost all were community-based pharmacists. For retinoids, we did exactly the same procedure for patients with the same criteria. We end up to 298 eligible patients from analysis. With mean age, of course, the retinoids patients were younger, 26 years old, ranging from 16 to 57 years old. As we expected, the vast majority were isotretinoin users, and the most prevalent level of education here was the undergraduate education. For pharmacists, we end up applying this criteria to 660 pharmacists with exactly the same mean age and range in the age as before with the pharmacists for valproat. Again, female professionals, almost all were community-based pharmacists. So here we have an overview response per country for valproat and for retinoids. We can see that the distribution among patients across the country varied significantly for both products, but especially for valproat. For example, in Denmark, we had 103 patients for valproat, while in the Netherlands, we had only 5. But this is the case because in the Netherlands, valproat is not fully prescribed anymore and not used. So it was very difficult to recruit patients for valproat and also prescribers. So the aim was to have 500 patients among all countries and 1,000, 500 healthcare professionals among the countries. But as the recruitment has been proven to be difficult, the country and the time has elapsed and it was going on the study with the COVID and all things. So countries had to adjust what they had. So we end up with an oversampling of pharmacists and a low number of prescribers. So let's move on to the results. I would like to point out here that I will mainly present the results based on the aggregated data that derived from the survey, because we had rather small numbers for each country, so it wouldn't have been meaningful to present them. So we observed extremely high awareness among patients and pharmacists. For valproat, 71% declared that they were aware of the teratogenic risk, while for retinoids, almost all of them declared that were aware, 96%, extremely high percent. And for pharmacists, for both products, we had a high percentage of pharmacists that declared that we know about the teratogenic risk of the retinoids. So we further wanted to ascertain how patients and pharmacists became aware about these risks. So here there's a plot that compares the two products. With the dark blue is the valproat and with the light blue the retinoids. And on the left we have all the possible means of information. And we can see that for patients, specialists play a key role in informing them about the teratogenicity, especially when compared to the general practitioners. So if patients declare that they became aware about teratogenicity after verbal communication with their specialist, the second most prevalent means of information was the package information leaflet. For retinoids, more than a half of the patients declared that they have used this leaflet to take information about the teratogenicity. The new educational materials, the patient reminder card and the patient guide, were used to a very limited extent by both groups. And here we can spot a difference as to the role of the pharmacist between the two products. Although in the valproat study, the pharmacists do not play a role in informing patients about teratogenicity, in the retinoid study, more than the quarter of the respondents indicated that they became aware after communication with their pharmacists. For pharmacists, so again, the plot that compares the two products, we can see that for retinoids, almost 75% of the pharmacists indicated that they have been aware about the teratogenicity even from their educational at the university. And for valproate, we observed that regulatory agencies, pharmaceutical companies, and academic knowledge played almost the same equal role in informing pharmacists about teratogenicity. Again, some difference. Regarding the measures, we asked the patients to declare which measure they're using the most while using these products. So again, we have the comparison between the two products. We can see again that the package formation leaflet is the most used measure. And for retinoids, almost all of them indicated that they have used this educational material. We observe difference as to the use of the risk acknowledgement form, maybe because this form is addressed to a different population, meaning the patients for valproate and the patients for retinoids. So although it is used to a limited extent by both products, we observe that the retinoids patients use it more than the valproate patients. And again, we observe difference between the products as to the warning symbol on the package and the discussion about contraception. For the retinoids, almost half of the responders declare that they have used or seen the warning symbol or discussed contraception with their prescribers, while for valproate, these percentages were much lower. So we further wanted to evaluate the performance of pregnancy testing. The results were not good. So for valproate, here we can see that before, during, and after the stopping the treatment, the vast majority of the patients declared that they are not having a pregnancy testing. And although the results were better for the retinoids, again, we can see that we have a poor compliance with this measure. And it's important to note here that although this trend that observed in the valproate was also observed among all countries, here regarding the retinoids, we observed some difference between the countries, meaning that in 3 countries, in Denmark, in Latvia, and in the Netherlands, we observed that pregnancy testing before and during the treatment was performed by half of the patients. So further about the contraception use, for the valproate, the percentage of the valproate patients that indicate that they are actually using contraception was not much higher than the percentage of the patients that indicated that they're not using contraception. Interestingly, in Greece, in Slovenia, the majority of the patients declared that they are not using contraception. In the retinoid study, more than the half of the patients indicated that they are using contraception, still a low percentage. And then when they were asked about how careful they are to use contraception when they are also being prescribed these products, 52% of the valproate patients declared that we are careful, while almost 80% of the retinoids patients declare so. So again, we see that the patients from the retinoids are more vigilant, careful to take contraception, but maybe this is be attributed to the fact that they're younger, so they're in need of contraception, and also prescribers maybe be more vigilant and careful when they are prescribing these products to them. So for pharmacists, we have 2 bar graphs here, one for valproate and one for retinoids, because apart from ascertaining the use of these education materials and measures at the moment, so we have with the dark blue the current use, we wanted to further evaluate whether pharmacists are willing to implement these measures in the future. So we have with the light blue the future use of these measures. And we observed that the warning symbol was for both products and for both groups the most used measure, as pharmacists indicated that this symbol reminds them to communicate with patients about the risk, about the measures, so they help them actually. Almost 20% of the pharmacies have used the patient reminder card and the Dear Healthcare Professional letter for valproat study, while for retinoid study, almost 20% has used the Dear Healthcare Professional letter. Overall, we can see that apart from the warning symbol, the new education materials were used to a very limited extent by both groups. And we observed that pharmacists are actually willing to use these measures in the future. Apart from the healthcare professional guide in the retinoid study, that not only they are not using this measure at the moment, they are not willing to use it in the near future. So the results per country, we did observe some differences across the countries. As I said, the warning symbol was the most used measure, and this trend was also consistent among the countries. However, we observed difference in the percentages, as we can see, while in Latvia, 69% of the pharmacists indicated that the warning symbol is the most used measure. In Denmark, only 24% of the pharmacies did so. In Greece and in Spain, the healthcare professional guide was mostly used in these countries. However, still in a very limited extent. And we also observed difference as to the use of the patient reminder card and the letter, which they were mostly used in Portugal and yes, in Portugal, both of them, and with substantial difference between the countries, as we see here. The reminder card was used by 60% of the pharmacies, while in Belgium, in Denmark, and in Greece, these percentages were extremely low. So for retinoids, again, the warning symbol the most used measure with variation again in the percentages. In the Netherlands, we observed that 92% of the pharmacists indicated that they have used the warning symbol, while less than a half of the responder indicated so in Denmark. Again, like before, low percentage in Denmark. And overall, we see that the Netherlands was the country where the highest percentages were observed, but this was as in comparison to the other countries, because if we see it as a sole country, we can see that still we have poor compliance with to the measures. And again, Portugal was a country where the letter was mostly used with 36%, again a low percentage, but compared to Belgium, it was only 3% of pharmacies. Last but not least, we wanted to evaluate it whether pharmacists believe that actually their behavior has changed after the implementation of these measures. So we conclude that 1/3 of the valproat pharmacists indicated that they actually change their behavior after the implementation of the measures, while only 25% of the retinoids pharmacists said so. And actually, we did observe difference between the countries, as we can see here, comparing the two products and across the countries. We can see that, for example, in the Netherlands, for both products, more than half of the responders said that their behavior has changed, while in Belgium, these percentages were extremely low. And apart from Slovenia, that the percentages were almost equal, in all the remaining countries, we observed that the shift was most pronounced in the valproat study compared to the retinoid study. In Portugal, for example, 56% of the pharmacists indicated that their behavior has changed after 2018, and in Greece and in Latvia, this shift was between the two products was most pronounced, as it was 2 to 3 times higher, the percentage. And we observed that for both products, the most influential measures were the warning symbol, the Dear Healthcare Professional letter, and the patient reminder card. To wrap up all this presentation, we observed a high awareness of teratogenic risk among patients and pharmacists, higher awareness of oral retinoid users than for valproat users. Patients became aware about teratogenicity mainly through their specialist and the package information leaflet, pharmacists through academic or professional training. We also observed low to moderate awareness about the measures of 2018 among patients and pharmacists, with variations across the countries. And we observed slightly higher adherence to the measures for all retinoids than for valproat, but this may be attributed to the fact that the measures for retinoids are there in force many years before the warnings of EMA came for valproat. So pharmacists and patients are more vigilant. We observed also that the new measures, the patient guide, the patient reminder card, and the risk analogy form were used to a limited extent from patients, and the warning symbol was the most important measure among pharmacists of both studies. The pregnancy testing and contraception use is still low for both products, and we observed difference between the countries as to the changes after the implementation of the measures in 2018, and difference between the two products. Of course, our study has some limitations. Limitations that are associated with the use of the cross-sectional surveys, like the social desirability and the selection bias. For example, we had younger women and more educated women as we recruited these patients through the social media. And also we had an extremely high percentage of awareness. So maybe prescribers and pharmacists wanted to give social desirable answers. So we end up to an overestimation of the reality. We also had a voluntary participation of target pharmacists contributing to maybe negatively to the validity of the results. We of course had an inconvenient sample due to the COVID-19 pandemic that has set another priorities to the prescribers and the pharmacists rather than completing a survey. We had a great variation in distribution across countries. We had incomplete questionnaires leading to a lot of missing data. And of course, not all measures that were evaluated at the moment of the survey were also implemented to all countries, not at the same time. And of course, additional national measures that have been implemented apart from the recommendations of EMA, like in the Netherlands, have added to the complexity of evaluating these measures. So we didn't have a very clear image in the end. So that's all.
Thank you, Anastasia. And I know you have to leave in 45